Okay, let's go.
Today, I want to talk about a topic that affects many teenagers and their families: delayed puberty. Puberty is the natural process of growing into adulthood, and typically, it starts between the ages of 8 and 13 in girls and 9 and 14 in boys. But what happens when these changes don't occur on time? That's what we call delayed puberty, and it's what we're diving into today. First, let's understand what delayed puberty really means. If a girl hasn't started developing breasts by age 13, or hasn't had her first period by age 16, or if a boy hasn't shown testicular enlargement by age 14, this might indicate delayed puberty. Now, this isn't always a reason to worry. Sometimes, it's just a natural delay that runs in the family. For others, it might point to an underlying issue that needs attention. There are several possible causes of delayed puberty. Some teens experience a constitutional delay, meaning they're just naturally late bloomers like their parents were. Chronic illnesses like diabetes, kidney disease, or cystic fibrosis can also play a role. Poor nutrition or eating disorders can delay development as well. Hormonal issues, such as problems with the pituitary or thyroid glands, can also disrupt the body's natural processes. In some cases, genetic conditions like Turner syndrome in girls or Klinefelter syndrome in boys are the underlying cause. The symptoms of delayed puberty can vary. For girls, it might mean no breast development or a delay in menstruation. For boys, it might mean no significant growth of the testicles, lack of facial hair, or a voice that hasn't started to deepen. In both girls and boys, delayed puberty can lead to shorter stature or a slower growth rate compared to peers. If delayed puberty is suspected, it's essential to consult a healthcare provider. They'll review the child's medical history and conduct a thorough physical examination. Blood tests may be ordered to check hormone levels, and in some cases, imaging studies like X-rays or MRI scans can help determine the cause. When it comes to treatment, the approach depends on the underlying cause. If it's a constitutional delay, often no treatment is needed, as puberty will eventually start on its own. Hormone therapy, such as estrogen for girls or testosterone for boys, can help kickstart the process in some cases. Addressing underlying health issues, like improving nutrition or managing chronic illnesses, can also make a big difference. And for those dealing with the emotional impact of delayed puberty, counseling or psychological support can be incredibly helpful. If your child or someone you know is showing no signs of puberty beyond the typical age range, it's essential to seek medical advice. Early diagnosis and treatment can make all the difference, both physically and emotionally. Thank you so much for watching today's video. I hope this information helps you or someone you care about better understand delayed puberty. If you found this video useful, please give it a thumbs up, share it with others, and don't forget to subscribe to MHCP